Is that it? Are we recording? Yes. Hi, Diana. I'm very glad to see you as always when we meet. I would like to ask you because I'm very, very curious. You once mentioned that currently you are working on two projects, one of which, for me, is something incredibly huge. That's about healing of oncological diseases. And the second one is about magnetism. I have a very slight, vague idea what it may be about because I work with energies, so I more or less understand. But I'm awfully interested to know what it is about. How did you come to work with it? Is there a connection between the two projects and why them? hmm Let me start from the end. Why them? So, indeed, there are two parallel projects, but they're not really interrelated. Well, maybe as all things in life, indirectly everything is related somehow to other things. In their essence, they're about different things. There are two different areas. But in a way, the senses that are put into them, and I will explain later, they are slightly integrated. Why did I start working with this? First of all, I believe that you have to work with something, not that you read in the book, but where you really have your own experience. You know that I personally have the experience of having had a breast tumor, and I got rid of it on my own. It doesn't mean that I'm propagating doing this, just like I did. And I never tell people that you have to cancel doctors, don't go to the doctors, etc. On the contrary, I always say you have to go to the doctors, you have to do the diagnostics, you have to do the self checks of your breasts. You have to listen to what the doctor says. And if it resonates inside and you think that I need to observe the doctor's prescriptions, do that. That's how I feel inside. But it doesn't mean that we have to just limit ourselves to this. Probably it's not a secret to anyone that in the classical treatment regimen, there's always the component of psychological aids to the patient. The question is, what is the quality of that? And also, my approach is about something different. It may be at odds at what is generally accepted as psychological aids to patients in certain situations who are facing the disease. My approach is more about self aid, self help, and it does not exclude the treatment. Could you please tell me? Sorry to interrupt. I lately talked to a person whose family member also has an oncological disease. And what they told me about working with the psychological condition, that the first thing that the doctors say is that you have to balance out the psychological condition. Because when a person is under stress, in dismay, fears, that does not enable even conduct the classical treatment. Is it about that or is it much deeper? It is much deeper, and I disagree that it's impossible to conduct classical treatment. Classical treatment can be done at any condition. The question is, what would be the effect? Here, my approach is about something different. You said very rightly that's related to energies and conditions. Of course, I'm not saying that I'm working with the energies of a person, do something to them, and the person all of a sudden has no cancer. That's not true. It is not so. All the work that I recommend to do has to be conducted by the person herself. But you first of all have to understand what is to be done. And very often you need someone by your side, a specialist to guide you through it. Because let's be honest, very small number of people is capable of talking to themselves honestly. That's why you always need a psychologist, because they are able to get your focus, attention focus, back to the problem issue, because our brain likes to rationalize and wander away from the problem, and you always need to have someone who would help you come back and focus your attention on the right thing. So, if I understand, you want to know in more detail what exactly is done, so you're not clear about that. Yes, I'm not clear about this. And first of all, I'm not clear whether it matters at which stage of cancer the person comes to you and asks you to give them a scenario. Are you able to give that scenario equally efficiently to a person on the first cancer stage, second cancer stage, fourth stage of cancer, and what it is about? My mother right now is at fourth stage of cancer. Within 1 year, in certain locations, metastasis disappeared in her. That's talking about your question about the stage. Because it's the work of the person herself, I don't judge how she will work. That's her responsibility. My responsibility is sharing my experience and how I managed that. If the person is super knowledgeable and experienced, they can work with themselves if they're capable of speaking with themselves honestly. But the majority of people is unable to do that. And in this case, they would most likely need someone to help and guide them. Actually, I will be talking only about breast cancer. I mentioned before that I don't work with the people who have encapsulations or tumors. And okay, let's say that we talk about encapsulations, cysts, tumors. We call it cancer because it's more or less about the same thing. So I don't, and okay, my thought wandered away. Okay, I don't work with the people whose cancer location is in some other organ, part of the body, or system of the body. I will explain why. I have my own experience, and I clearly understand and know in depth what breast cancer is about, how it works from the psychological point of view and psychosomatic point of view. How is it better to get rid of, through which attitudes, exercises, thoughts, and ideas, what you have to practice to get rid of it. Because it always deals with two things. First, that's what the tumor itself is about, tumor as a fact, because that depends on certain attitudes. And secondly, the localization itself, because different locations testify to different things. So, once again, I work with the people who have breast cancer or breast tumors because there are very common diagnoses such as fibrocystic mastopathy, diffuse mastopathy, and that's all pre cancer. If you don't treat this, and we treat it by hormonal therapy or surgical operations at later stages. So before it becomes malignant neoplasm or a benign neoplasm but very bulky in volume. So in our country, it is treated by hormones. What are the hormones? These are substances that directly impact your body. These are substances that lead to a cascade of reactions in your body, and sometimes they are irreversible, and that influences the metabolism, the entire humoral processes. And if you're treating one area with the help of hormone therapy, it's not necessarily that you are at the same time not harming the other system of your body. I have this experience. Initially, before I started practicing my method, which I will tell you about finally a bit later, of course, I went to the doctors. And once again, I don't propagate not going to the doctors. On the contrary, you have to do the diagnostics at as early stage as possible. Because if you get rid of something in the beginning, it's much easier and efficient than if you do it at some later protracted stages. Then the body will not have the time resource that you may need for working psychologically with yourself. So when I came to the doctors, of course, I was prescribed hormonal therapy. And within one night, and nobody believes me, they say it's not possible, but within one night, at this part of my chin, on my chin, white hair this long grew within one night. That's just awful for a woman when you wake up and you understand you're taking the pills and you apply them topically on your breast, and that's how potent they are, how potently they affect your body. That sounds awful. That sounds awful indeed. If you think about it in a detached way, that's one thing. But when it's about you and you see this in the mirror, when you start taking hormone pills and find out that, excuse me, but on your buttocks, you have craters, cellulite craters on your buttocks. And when hair starts growing on your chin, that's not funny for any girl. I don't have a right to cancel doctor's prescriptions, but every person has a right, the legal right, moral right, to choose him or herself whether they need this, whether their body needs something. If you totally trust the doctor, and if it's a really knowledgeable expert, unfortunately, there are not so many of them these days, of course, it's your own decision. At that moment, and I will be telling you about myself, at that moment, when I saw this on my face, I realized very clearly I will no longer do it. I will no longer take the hormone pills. And I discontinued, but in a very inexpert way. That's very important. If somebody decides to withdraw and discontinue hormone pills, you have to do it in a very expert way. There's a certain pattern, a certain regimen of withdrawal, and you have to do it with the doctor's supervision. So I did it very inexpertly based on my emotional reaction. And in 2 years, I got the result. I came to do an ultrasound scan because I had a burning sensation in my breasts. I had enlarged lymph nodes. And my family members started telling me, go to the hospital and check what's going on because it's not normal. And the doctor who did the ultrasound scan, asked me, shall I speak frankly with you? I saw that she was probing me to understand whether she can speak honestly and frankly to me, or she should just give me the ultrasound statement and let me go. And I said, yes, please, tell me all the truth. So she told me, well, look, I don't have a right to say whether it's malignant or benign. But based on my experience and all the signs that I see, and that is the very increased lymph nodes in the armpit on the side of the neoplasm, the indistinct borders on the ultrascan of the tumor, then it does get the blood supply. Fourth, the burning sensation. So these are indirect signs that, okay, I had the burning sensation. It's not painful, but it is very discomfortable and it's all the time. And then the size of it, it all gives the about 80% probability that your neoplasm would be malignant. You can understand my stress. So I came out absolutely stressed, and I was thinking about that chin hair and thinking I probably should have made a decision to be a woman with a beard than be a woman that's not alive, or a woman that does not have breasts, because or a woman without hair, because this all leads to all these things. You know, I'm looking at you today and you're smiling, you're glowing. and you're happy with your life. And in the middle of this difficult topic, I'd just like to know that everything is possible. And looking at you, it gives you faith, gives me faith that you can cope with anything. Thank you for the example. Yes, I would like to say that I share all of the information I have accumulated throughout my experience. If there are any questions, I share absolutely for free. The only thing is, I don't give consultations for free, but all the information that I have, that I can share with the person so that she can do it on her own, I do this absolutely for free. I think this is the way to do. This is the right way. So when I came to the oncological center, the doctor who had a 30-year experience in cancer treatment, and he's also a breast physician. Unfortunately, he passed away a year and a half ago. So he palpated and found all the cysts, all the encapsulations, and all neoplasms. I had a large neoplasms and a number of cysts in both breasts. So he found them just palpating with his hands. He said, I don't need an ultrascan. I showed him the ultrascan, and he said, okay, based on my experience, I can tell you that you have to get prepared for chemotherapy. Okay, we cannot state whether it's malignant before you do the biopsy. If it's not malignant, we will just surgically operate it, take it out, and you're very lucky. But if it's malignant, and that's most probable based on my experience, get ready for chemotherapy, and so on. So while I was going there, and that was quite a long ride because the clinic is in the suburb, I was sitting and thinking, how do I create this disease inside of me? And that's already to start answering your question. So, my first question was, and you have to ask yourself honestly, how do I create the sickness inside of me? Because that's what I do. But this is a very powerful question. So, just realizing that we ourselves create this to ourselves, you have to be at a certain level of awareness. Yes, you have to come to this question because what stops you? What hinders you? Honestly. Okay, you, for instance, choose to have a classical treatment regimen, but why can't you at the same time work with yourself if you're one of those people who are capable of that? For whom it is possible to heal from the psychosomatic point of view. Why not working with yourself? Please. Yes, I would like to say even more. Based on my experience, you can get rid of a problem surgically, and you should if the situation is such. But if you don't eliminate the reason, the cause of the situation, there is no guarantee whatsoever. If you do not change your attitude, your mindset, and that's being about being honest with yourself, if you don't change that, it's very probable that this all will come back. Not very probable, it's 100% that it will come back. That's why we have so many recurrences in cancer treatment, because you can cut off half of the body. But if you cause this with a certain emotion, and I will tell about this, about these emotions, you will do this to yourself once again. It doesn't work like that. So, there are two components to this: the location of the tumor, that's one thing, and the basis, my look at the world, my mindset, the prism, how I look at this world. As I said, I work only with breast cancer, so patients with breast cancer. But the half of the answer suits other cancer patients. Because once again, tumor, any cancer, is about the feeling that the world is not safe for me. That's always like that. So while I was going to the clinic, I was thinking, how do I create this to myself? And I started thinking what irritates me. So you have to kind of untangle the snarl. So I came to the conclusion within a half hour that I perceive several people who are around me as unsafe for me. Not that they uh, pursue me or there is some direct threat from them to my life or my existence or to my psychological or moral health. No. But just based on my previous experience, and we all have the background, certain things in people's behavior, in their words, in their actions, nonverbal things are perceived through your background, through your experience. So when you perceive this, you might not be conscious about this, but some person just triggers you or irritates you. There is nothing really bad going on between you two, but actually you feel the whole conveyor of negative emotions when you interact with this person. So if you start analyzing these negative emotions, you will always come to the conclusion that this person carries some threat to you, because the majority of negative emotions is always about safety, your personal safety. So if a person irritates me, gets on my nerves, bugs me, drives me nuts, if I want to do something with this person, get rid of him or her, not physically, of course, but evict him or her out of my field, and we may not be conscious about it. We'll just think, okay, get off my back, get out. If you start digging into it, what's behind it, you will always come to the idea that for some reason this person is unsafe for you. Maybe he or she rings some bell from your previous experience. Maybe you're transferring some of your previous experiences on this person. So once you come to this idea, you can come to a realization that it's not only this person who is unsafe for you, but generally that the world is unsafe for you. So maybe some people or the world in general is unsafe for you. That's the main idea behind the psychology of cancer patients, that the world is unsafe. You can read a lot about resentment, offense. So if we talk about tumors, that's the idea that creates a tumor. The world is unsafe. If you look at it from the point of view of science, I mentioned it to one lady not so long ago, but I will repeat. So, if you look at it from the point of view of science, this metaphorically can be traced. The whole psychological behavior can be metaphorically traced at the material things. Let's take a living cell. Each cell has a mechanism of apoptosis inside of it. So that's the mechanism of self-destruction. Any cell, when it comes to the end of its lifespan, or if the cell is broken, if it's mutated, something is broken inside of it, or at the end of its lifespan, the apoptosis mechanism gets started in this cell. But a muted gene, a mutated cell, will never destroy itself. It will keep multiplying and growing, and it will try to involve other cells, the healthy cells. It will try to absorb them and make them also mutated cells. And that becomes a generalized process throughout the organism. How does it echo in our life? Look, if I perceive some person as unsafe, what's easier for me to do? Destroy myself, eliminate myself, or destroy this person, or absorb this person? Well, this is a very deep philosophical question. I never looked at it from this perspective. So, based on what you're saying, a human being is a representative of this world, or let's say a cell of this world. Let's say we perceive the human being as a person of this world, and you understand that your volume is not comparable to the volume of the whole world. Then your decision is not to do something with this person, but to do something to yourself. Do I understand you correctly? Yes, But you have reversed it into a different train of thought, because a cancer patient does not have this mindset, this picture of the world. A cancer patient has this idea: the world is unsafe for me. Any organism tends to protect itself, to preserve itself. That's our basic instinct. We don't work like this. We don't destroy ourselves with apoptosis, because we are people, we live on. So if you don't sense this world, you, Nastya, are knowledgeable and experienced, and you perceive this world as a common biosystem. This is very interesting because, and that's a very interesting topic. Yes, I know quite a lot, but that's a totally new perspective for me. I see it as a person who knows some things about how energy works as follows. Let's say with cancer or autoimmune diseases. Actually, cancer is an autoimmune disease. Or let's say take another autoimmune disease. So that's the self-destruction process that's launched. When you don't look in depth to find your truth, there is the self-destruction process that's launched. That's why I said that the person, when they understand that they will not cope with the world, they will not come to an arrangement with the world, because you don't need to struggle with the world, you need to know how to interact with the world. So by understanding that they will not be able to interact with the world and arrange things with the world without understanding that the world is a natural habitat that's safe. It's only your consciousness that tells you about unsafety. That person has the self-destruction process launched inside. But you see it differently. Tell me about this. That's interesting. I don't see it differently. You said it very correctly. But that's what I understand now. But cancer patients don't see it like this. They don't sense the world like this. Well, that's how they came to the cancer stage. If that was their perspective, they would not reach the stage. Yes, but they can't see it like this. All of us have our backgrounds. They see the world as unsafe. They don't sense this biosystem as a common organism. You do it, I do it now, but they don't. For them, there is myself as a subject, him as a subject, or him as an object. For them, this person is unsafe. So if you look at it from this perspective, you understand logically that you should destroy this person, take him or her away. So these people work for destruction. I don't want to insult these people. I haven't said anything bad. I had the same problem before. Let's say I used to work for destruction. I will talk on my behalf, not about others. I worked for destruction. Understandably, I did not go to kill anyone, but inside my head, I can do anything to anyone in any way. I can lead any conversations in my head or have any thoughts, give any responses, insult people the way I want. And very often these people do this, and they might not even realize it. They don't realize it. You talk to these people and they say, no, I never do that. I cannot name names, of course, but it's been so many times that people would answer, no, I don't do it ever. That's not about me. Come on, admit that it's about you and the process will be launched. Just admit that it's about you. That's why I say you have to be honest with yourself. You have to be able to talk honestly inside of your head, and you don't need to talk to anyone else. Just say it honestly to yourself that, yes, that's about me. Indeed, I do that, and I do this. Admit this, confess, just for healing, not to tell anyone, to give some reason to judge yourself. No, just say to yourself that you've done it indeed. It took me 3 hours to do this, but I don't compare people to myself because I have a different background and different experience. I've studied, I've practiced to do this. I absolutely do not expect other people to have the same result. But this is all real. It's all possible, and you have to do it if you want to have some effect. So you have to sense it. That's exactly what you've said. You feel this. Just like the organism feels, senses this cell as a mutated cell, a potentially cancer cell, the system senses this person, and it's easier to get rid of this person, the person that has this program inside, the person that works like this, who is trying to seize healthy people, healthy cells. That's the first issue. That's about how the cysts, encapsulations, neoplasms work, how they get started. If we are talking about the location, about the breast, that's always clearly about resentment, about being offended by someone. Oh, you hung up. Do you hear me? Yes, I do. Nastya, you hear me? Yes, I hear you. All right. So that's always about the resentment. A young lady asked me recently, how do I understand whether it's resentment or being offended by a man or by a woman? Because I know that one part of the body is responsible for the man, another for the woman. So if it's on this part of my body, do I need to look for a man who I was offended by? And I say, no, you shouldn't be looking for a man who you resent or were offended by, because it's usually a generalized process, and cancer usually starts, if you are able to catch that moment, after the diffuse mastopathy stage. Unfortunately, we often don't catch this moment. But cysts very often happen in both breasts. So there is no sense whatsoever to work with just one offense. Let's say, in this breast, I have an offense against this person. No, we are trying to change the general mindset, the general look at the world, so we get rid from or we get rid of everything that we don't need. Then, what is my technique? What is my offer? How do I suggest working with it? That technique is not purely mine. We invented it together with my colleague, a psychiatrist. And that's how we did it. Once we were just sitting and talking. We've never had this idea of let's create this technique. At one point in life, I worked in a medical institution, and I was very close with a psychiatrist, a lady. So we were sitting and discussing our things, we were therapeuting each other, and we came to the idea, although it's a common fact, you can find it anywhere, that actually a person tends to forgive someone, or their subconscious tends to forgive someone when they ask for forgiveness for this person from somebody else. Well, it's easy to say, okay, forgive him or her. But just imagine if you've been this long offended by someone. So you come to me, you cry. Okay, not you. Somebody comes to me and says, okay, I have cancer. And I tell this person, forgive him or her. Will they? No, it doesn't work like this. I often communicate with the religious people, with the believers, their parishioners in their churches, in their institutions, religious institutions, and they really get help there because they're told you have to do it, you have to forgive, you cannot buy but forgive. There are commandments, canons, and instructions by gods and prophets that you have to forgive. Well, okay, I understand that I have to, but I understand it in my mind, but not in my heart. And I can tell myself, okay, I gotta forgive this person, but inside I will not feel the forgiveness. You understand? Of course. So when my colleague and I were discussing this question, she says, okay, I know, and I knew that as well because it's not a secret to anyone. that our subconsciousness is ready to forgive, and it does forgive others almost in all situations. If you ask for forgiveness of this person to somebody else, that's an interesting technique. Yes. And it gets even more interesting. So then a question arises. You are a sane, healthy person, right? So you won't come to me and you won't say, Diana, forgive my ex husband for everything he's done to me. Okay, I will say, okay, I forgive him. I will. But you can't come with this question to everyone, or you cannot come to me all the time about every person. Because when I started working with resentment, it was like a conveyor of people who I never thought can be related or connected with my problems and my sickness. I haven't been thinking about these people for a long time. They were not present in my life for a long time, but they were in my mind. Yes, the cell memory is very lengthy. Exactly. So this friend of mine says, I came up with something. I know who you should ask for forgiveness. You should say, Lord, forgive this person and forgive me. And I'm thinking, yes, that's logical. It doesn't have to be God that you talk to, it can be any higher being, a higher mind that you are connected, that you talk to. So, whatever resonates with you, that you can contact, you can say or use the words universe, space, God, the name of God, if your God has a name, heaven, whatever resonates inside of you, what you believe hears me, and with what you converse. Well, when you say this, I have get goosebumps. Yes, me too. Yeah, it's a super cool technique. Well, listen on. It's a prerequisite in this technique that you have to say or name the name of a person. Let's take any name. Lord, forgive Nastya and forgive me. And you have to think about this person and picture this person inside your mind. You don't have to recall exact situations. One girl asked me, do you need to recall the precise situations? No, no. Don't get irritated even more. So it has to be some phantom, some image of a person. I was imagining people in certain specific locations. It was unexpected that all of a sudden I imagined this person in a forest or on the road outside my summer house. Somehow this person was associated with this place in my mind. Before, I never thought that any people were associated with certain spaces inside of my mind, that some person will be pictured by my mind in a certain location, and you will never know this before you start practicing it. You will not find out many things before you start looking inside, and it's the brave new world waiting for you out there. Yes, but you understand that many people come to this point of looking inside when it's just way too late. Yes, and that's exactly how it works. Basically, it is expected that all of us, when we are already um, tired of playing some obvious things, will start looking inside and try to understand how it all works, how it is all arranged. But many people never get to this point throughout of their lives. Exactly, the majority of people. When everything is fine, there is no sense for us to search deeper, especially when it's unpleasant, when it's painful, or where you can see yourself in a not very nice light. Well, I would argue maybe in one of our further conversations, because I know many cases when everything is super fine, but somehow inside it doesn't feel right. And maybe it's being spoiled about the situation. Well, actually, it's about the fact that for you to stand up from a nice couch and stop watching a fun movie, of course, I'm exaggerating now, and start looking deeper and researching, you have to have a motive. what you're saying right now. If it looks nice on the outside, it's not necessarily it is really good. Then please explain because different people watch us. Okay, the external picture may be super beautiful, but it doesn't mean that inside you will feel good. So, this is actually the reason why we go deeper. But some people are fine with a small hint and they start working and looking for something bigger. So, for some, a small hint is enough. For others, it's not enough, and something more serious, a serious circumstance, is necessary to spur them to start studying it. Well, that's about learning and knowing how to hear yourself and understanding what you've heard. Okay, where have we stopped? Let me finish about the technique. Do you remember where we stopped? You were saying that you have to imagine a phantom, not a phantom, actually, the image of a person, wherever you get this image. So you say, so I will say how I did that. I said, Lord, please forgive this person, and I named the person, and forgive me. This is very important to say forgive me as well. That's a prerequisite condition of this little phrase. Okay, let's not be disparaging, not little phrase, a cool phrase that really works. So when you start doing this, first you think, oh yes, I'm resenting this person. And then you start recalling the crowds of people who probably are no longer present in your life, and you would never think they are related to any resentments or offenses. But one by one, they start coming up, and that means you have to mention them as well. But at this moment, if you're feeling resentment or irritation, so you're saying this and this offended feelings come up and you feel irritation, you have to say it once again and you have to repeat it so many times until these feelings get quenched, get blunted. It doesn't mean that when it's blunt that I have forgiven. No, you have to do it all the time in your head, every day, and for quite a long period of time. So maybe not a month, not two. Maybe for someone it will take a month. For me, it was 3 weeks. I don't know what is the level of awareness and perception of the person who will watch this and try to do this technique. So I cannot guarantee what period of time it will take. So, but you have to be guided by your feeling, right? When you do it and when you no longer feel some irritation, it's all out. Yes. And then you take the next person. So you take them one by one. I was going through everyone. You won't believe me. I was mentioning some relatives that I haven't been talking to a long time. Maybe I've seen them just once a year when I was a child. I even named them. You can understand how thorough I did this. So, on the large scale, we don't realize the whole level of burden inside of ourselves. You know, if a person is a churchgoer going to take Eucharist in the church and they're asked before the Eucharist, have you sinned? Have you done the sin? They think, well, I'm not a great sinner. Maybe I've had some petty sins. When they ask you whether you've done this, you will think and you will realize, yes, I've done this and that and that. I'm not propagating now that people should go to church. I haven't visited church for a while now. But it's just an example for the churchgoers. When I say this, they will understand right away what I mean. That's the same thing. You don't understand the scale of the disaster inside of yourself that you have towards other people. So, once again, to summarize, you can say here what side of the body is the tumor, what exact person has offended me. Don't take just one person, do everyone you recalled. So, you do this. And then I was asked about the affirmations. Actually, affirmations is a really cool thing. It is a thought that's totally contrary to the idea that creates sickness inside of you. If we talk about cancer, breast cancer, that's about safety, love, that the world accepts me. It's a very good asset, but by itself, affirmation is not enough if you're not aware and if you don't accept or rebuild this picture of the world inside of you. So, if you don't go through this process inside of yourself, then affirmation will be useless. Well, as far as I understand, this is just some additional tool to accelerate the process. So, on one scale, you have this internal crap, let's say. Yes, that's exactly the crap. Yes, and on the other hand, it is some counterbalance. And as soon as you clean up on the one side and just add good things on the other side, then the scale will balance out. Yes, it will balance out the way it should, the way you need it. There was one person, I will not call him wise or sage, but a person who is trying to live according to his heart and his soul and is leading a not very traditional way of life. Once he said something to me, it was a long time before the problem I got. He said, Diana, cancer is the conversation of a man and God. That's what he said. So, whatever they arrange in their conversation, that will happen. So, yeah, I got goosebumps now. So, what I suggest, it really resonates with this idea, it's directly correlated to this idea. And I believe that if you're ready to work with yourself, if you change this life paradigm, the outlook on the world, the mindset, which is very difficult, it will not take 2 seconds. But if you keep guiding yourself in this direction, into these thoughts, if you know how to do it, and if you use as a tool the affirmations, and if you practice this technique, this will give wonderful result. The tumors will go smaller. That's for sure. Whoever is watching me, please know. If you do it, I cannot promise anything because, as I said, it's the conversation of man and God. But what I know for 100%, the tumors will go smaller and might disappear. That's absolutely so. This really works. Thank you very much for speaking about it, for sharing this. I think the more there is open information around about what it is, how it works, the better. When one person mentions something, that's one thing. If you don't have a general idea about how the world is arranged, you may not even react to what you hear. When one person speaks about it in detail, based on their own experience, the second person, the third person, you start thinking that this cannot be a coincidence and there's definitely some pattern that you have to look into.